I hope you enjoy this review and find it helpful in your studies. You can get full ad-free access to the MedEd 101 Nursing Pharmacology Review course at meded101.com/nurse. MedEd 101's Nursing Pharmacology Review course is built to make meds finally click. You'll get nearly 20 hours of ad-free, on-demand video lessons, downloadable slides you can study from, over 40 cheat sheets and study guides, and practice questions to assess what you know. Whether you're preparing for exams or building real-world confidence, this course is designed by pharmacology experts for nurses. Stop memorizing, start understanding pharmacology at meded101.com/nurse. I want to share some of the most important tasks that nurses do surrounding medication management, and hopefully I can provide you some good examples here too as I'm going through this of specific medications and common mistakes that I've seen in practice. So patient assessment, very important skill set, task for a nurse to do. Medical history and allergies, really, really important. We have tons of drugs that should not be used in certain conditions. We've got medications, heart failure comes to mind. We've got meds that shouldn't be used in heart failure. Pioglitazone for diabetes, for example, that's a medication that should be avoided. And so knowing that medical history, as well as understanding some of the basic medications can be really helpful in helping you identify that issue for a provider, for a patient, helping the pharmacy out as well. So important to make sure we understand that medical history. Reviewing patient allergies. Nurses have caught a mistake of mine. I'll never forget that when I was first a pharmacist within a couple of years of graduating. I had made a recommendation about starting a medication, and the nurse kindly wrote back to me and said they had an allergy to the medication that I was suggesting. So I learned that lesson the hard way and learned that lesson from an experienced nurse. So very, very critical that you understand allergies, and obviously if you think there's potential for cross-reactivity or issues there, that's definitely something you need to talk to pharmacy about or the attending provider. Recognizing that vital signs, labs, and clinical symptoms are going to be very, very important. So whenever a patient reports a new symptom, I always encourage, particularly in our geriatric polypharmacy type patients, I encourage you to assume that that's a medication adverse effect. Okay, and so that should prompt you to go back and look at the medications that patient is taking. Vital signs, obviously, we've got lots of blood pressure medications that can affect heart rate, and obviously we're going to be monitoring blood pressure for efficacy if we're using blood pressure medications. Labs, many medications affect labs. We've got seizure medications. We've got medications for bipolar disorder. We've got diuretics for fluid overload. These can all affect certain labs. And obviously I'll explain some of those more thoroughly throughout this presentation, but we've got to monitor those levels and understand that variations or labs out of range can certainly be affected by medications. Contraindications, potential drug interactions, those are going to be important to assess and pay attention to as well. Evaluating pain level, mental status, and functional status. So we have plenty of medications that can affect all those. Obviously, we're looking at analgesics here. As far as mental status goes, many medications can cause sedation and confusion, especially at toxic levels. So that's very, very important too. And then from a nursing perspective, I love it when nurses are looking at that patient as a whole and saying, this particular patient can't do this. So let's say we've got an inhaler, for example. You as a nurse recognizing that patient can't utilize a specific device that they're supposed to be taking on a regular basis, that can help prevent a COPD hospitalization. Okay, so you can really have a great effect there in making sure that patients understand and know how to use their medications and can do it safely. All right, medication administration. Let's get into a little bit of specifics here. So historically, we've had the 5 rights of medication administration. I'll go through them on the next slide. And then additional rights of medication administration that have been added as well. At preparing and administering medication via appropriate routes. So we've got IV, IM, oral, sub-Q, transdermal, and I've got information coming up on the various differences between these. Using aseptic technique, obviously trying to reduce the risk of infection and obviously hurting our patients more than potentially they already are. High alert, high risk medications. Very, very important here. We've got, anticoagulants, for example. We've got insulin therapy. When we make mistakes, when we make medication errors on those type of medications, there's a very high likelihood that patient could significantly be harmed or potentially even worse. So pay attention to that. Understand which medications are high risk within the setting that you work. Verify controlled substance counts and documentation. So that's going to be important as we're administering our, opioid pain medications or potentially our ADHD stimulant type medications or benzodiazepines, so on and so forth. All those medications that are controlled substances. And then paying attention to the orders, holding medications when clinically appropriate or necessary based upon those provider orders. So a classic example there is digoxin, beta blockers. These can drop the pulse, and if they lower pulse too far, we really don't want to give more of that medication because it can certainly worsen that. All right, so here's the 5 rights. Right patient, I think that's pretty common sense, but honestly, when we're talking about polypharmacy, me having some experience in long-term care consulting, if you give meds to the wrong patient, this is one of the riskiest medication errors. Okay, I had a patient that was on a high-dose antipsychotic, and their next-door neighbor within a long-term care facility got that dose, and it actually dropped their blood pressure so far that they ended up dying because of that medication error. So I can't stress that enough. It seems really obvious. It seems really easy. But in the busy workday, if we make that error, that's a very, very risky error because, we may be giving, 5 medications instead of 2. And those medications absolutely may not be right and may not jive with the conditions and the disease states of the incorrect patient. So super, super critical on the right patient medication administration right. Then we've got medication. So confirm that the drug matches the order. Where we can get into trouble here is look-alike, sound-alike medications. So Celexa versus Celebrex, they may look a lot alike on the page, and that certainly can trip people up. Right dose, so making sure that dose is correct. Some drugs are probably higher risk than others. So, for instance, if you've got a vitamin and we give the wrong dose, that's probably not as life-threatening and risky as, let's say, a high-risk medication like warfarin or an anticoagulant, for example. So, making sure that dose is right is very, very important for sure. Route of administration, so making sure we're giving it, oral if the order says oral. If it's IV, give it IV. There are some differences in bioavailability and how much that medication is absorbed. Also, obviously, the risk associated with giving it in an incorrect or inappropriate fashion can be an issue. Typically, I would say that's more so of an issue that I've seen in patients. I've seen some wacky things where patients have, tried to take ear drops or eye drops orally, suppositories orally. I've definitely seen and heard of some wacky things happening with patients. And so that goes back to that role as an educator, and obviously nurses being a big important team member in recognizing the appropriateness of medication administration. And then we've got right time, of course. So we've got meds that can cause insomnia. So corticosteroids, for example, we like to give earlier in the day. So that's a medication like prednisone, often used for acute inflammation. We ideally like to give that earlier in the day because it causes insomnia at night. Another one that's really sensitive to time is Sinemet. So this is a medication used for Parkinson's disease. And if we're too late, if we're too early on the dose, those fluctuating drug levels can be pretty sensitive, and patients could have symptoms of Parkinson's disease if it's not given soon enough, or potentially more adverse effects if we're giving it too often and too quickly. So making sure that time and frequency matches up with what we want to do is important. Hey, nurses and nursing students, want to reinforce pharmacology without boring old flashcards? Check out the Nursing Pharmacology Crossword Puzzle book from MedEd 101. It's an Amazon bestseller. It turns drug classes, mechanisms, side effects, and high-yield facts into fun, brain-boosting puzzles that help you remember what matters most. With over 2,000 questions and clues, it's perfect for study breaks, group review, or solo practice. This book makes learning pharmacology engaging. Grab your copy and start mastering meds in a way that's actually fun. Find it now at meded101.com/nurse. That's meded101.com/nurse. Here's the expanded medication administration rights. Documentation. So this is obviously an important piece as far as regulatory issues go, whether you're in a hospital looking at Joint Commission or long-term care, looking at your state or federal surveyors, having that documentation in place that what we did was appropriate. So why we gave that morphine, it was for pain, it wasn't for anxiety or some other weird indication. So recognizing that documentation is important. As well as, let's take the example of a PRN, an as-needed medication. What happened when we gave that as-needed medication? Did the patient's pain improve? Did the anxiety improve? What were we giving that medication for? And did it actually help? We want to see that documentation. So that way, I know as a, clinical pharmacist, like, okay, this medication is really helpful for that patient, as well as obviously the attending provider is going to want that information. And that way, we can make better judgments on which medications are appropriate. So the right reason, so verifying that the medication makes sense for the patient's diagnosis or condition. So, what's the diagnosis for that medication? So if we're giving metoprolol for atrial fibrillation in rate control versus high blood pressure, we're probably a little bit more focused on what we're trying to do for the rate control. Now, we're probably going to monitor blood pressure too because we don't want it to dip too low with that medication, but understanding the reason we're giving the medication so we can monitor for that clinical response and make sure the drug actually works for that patient. Right response, so monitoring the patient, making sure that medication's working as intended, and then of course the response being, are we having side effects as well? So making sure to look out for that. Right education, teaching the patient what the medication is for, how it works, and obviously possible side effects as well. So patients know what to look out for. They can alert you, alert the healthcare team, and we can make changes as needed. And then the right to refuse. So it's important to respect patients' autonomy. They can refuse medications. It is their right to absolutely do that. and it is ultimately their decision. Nurses must document that refusal, and it's important to notify the attending provider that as well. I would also go a little bit of a step further here. If you're a nurse and you're having a patient refuse, don't just say, "Oh, okay, you don't want to take it. That's fine." Try to get to the heart of the issue. Maybe a neighbor told them, like, this medication is trash, you shouldn't use this medication, and maybe that's why they stopped taking it. Or maybe they're having a legitimate side effect that they can tell that they're having from that medication, and that's why they don't want to take it. So documenting, notifying the provider of that reason, that can go a long way in helping build that relationship within the healthcare team, relationship and trust within the healthcare team. All right, monitoring and evaluating, so assessing therapeutic benefits of medications. Love that when nurses do that, making sure that what we're doing actually works, especially when I get to review patients on 20, 30 plus medications. I love it when there's documentation to say that medication for muscle spasms is really helpful and it works. Oftentimes I get the list of 4, 5, 6 pain medications, and it's like, okay, well, which one's helping? And sometimes it's hard to differentiate what's helping and what we can get rid of, and what the patient really feels is beneficial. So that can definitely be a challenge. And when nurses monitor, pay attention, and document that this drug has been beneficial, that can be really, really helpful in helping the healthcare team assess what's going on with the patient. Watch for adverse effects, allergic reactions, very, very important thing to do there. Grateful for nurses' help there. Monitoring lab results, so making sure we're getting those labs done in a timely manner to make sure we can adjust drug therapy appropriately, and obviously make sure that those medications are safe that are being used. Fluid status, vital signs, mental status, again, all good assessment things that can help us make sure medications are safe and appropriate. Important role in monitoring pain and functional outcomes. Medications can certainly aid in that. We've got, NSAIDs, we've got opioids, we've got all sorts of different types of pain medications, and we want to make sure that we're adequately controlling pain and obviously not causing side effects as well. Any unexpected or severe reactions, those are going to be an immediate ASAP type situation where you got to notify a provider, and obviously help assess, is this an emergency? Like, do we need to get them to the emergency room right away to have a little bit more closer monitoring, and obviously recommend immediate discontinuation of the suspected medication that caused the severe reaction or adverse effect. Education, nurses are playing a huge role in this, understanding and explaining what the medication is used for, how to give it, which route to give it, when to give it, all super, super important things. Education on those side effects, as I mentioned previously, helping to teach adherence strategies, whether that be a pill box for that resident, that patient, whether that be alarms, whatever the case may be, all those different adherence strategies, trying to help your patient find the right one that works for them. Demonstrating and educating about device use, whether that be, inhalers, insulin pens, patches, and how those medications work. Very, very important. Discharge instructions, written materials, and I would add in here as well a way to follow up if there's questions, and who to contact, because when you send a patient home with 3, 4, 5 new medications and they're already on 10, 15, 20, there's going to be questions, and they've got to have a place that they can call and that they can trust. And so you providing those discharge instructions, those written materials, and contact information on how to follow up, super, super important. And then promoting lifestyle changes that complement medication therapy. So heart failure is a great example there. Diabetes is a great example there. Those lifestyle changes can actually help us potentially take less medications, which is what I love in some of the deprescribing and reducing medications in our geriatric patient population. Teamwork and communication. Nurses play a vital role, a central role in patient care. You guys are all so important, and really that frontline worker with patients, right in there doing all the hard stuff that pharmacists and providers sometimes don't do. So definitely appreciate that. You guys are top of the list as far as members of the team there. With that, working with, like myself as a pharmacist, working with the primary care provider, clarifying those unclear, unsafe orders. I've had nurses come to me after they've went to their primary provider who have still been nervous about a medication or a medication situation, because they've seen issues with a certain situation, and maybe they didn't feel like their primary provider was taking it seriously enough. So if you go to your provider and you're still uncomfortable with what they said and the dose or the medication or whatever we're doing, or maybe it's something with the patient too, don't hesitate to reach out to a third party and somebody else, and just say it to them and say, hey, am I off on this? Is there, are you comfortable with this situation? Double, triple check. If you really feel uncomfortable with something, lean on another nurse, lean on a pharmacist, lean on another provider, lean on somebody else. If, somebody that's directing care of that patient, you're not comfortable with what they're doing, what's going on, don't hesitate to find another party to try to get involved. If that's the one thing you take away from this, that would be a really, really good thing. Because I've seen situations where assumptions have been made, and nurses have kind of blindly followed things where they didn't feel comfortable, and that's can end up in an unsafe situation there. So again, clarify if things are unclear, unsafe, and you just trust your gut on that for sure, and get another opinion if you're not comfortable with what you've heard from somebody for sure. Communicating significant changes in condition. This can help from a medication standpoint. This can help us pick up on adverse effects, new drug interactions. If we see a significant change in, cognition, or they're falling, or, there's new behaviors, that could be indicative of a medication adverse effect or interaction or something else. So communicating that, making sure that, we're aware of it as pharmacists, or if you've got a pharmacist working on the team. But, the primary provider obviously has to know about that as well. Again, collaborating with everybody together, participating in rounds and sharing relevant information where, maybe a patient has discussed or has stated that, I've really got these dry eyes are just killing me. Maybe it's something that's just a nuisance. But as pharmacists, I know of 50 meds that could cause dry eyes. And, if we could get rid of that medication that's likely causing that, that's a great thing for you to bring up on interdisciplinary rounds and things like that. So definitely can, even those simple things where it's, maybe just a nuisance, but, maybe it's underlying and it's a bigger thing that, maybe somebody else's eyes will pick up on that. Using SBAR or similar tools, kind of for structured communication. Advocate for dose adjustments and medication reductions and medication increases as appropriate. Medication reconciliation. I see so many mistakes on medication reconciliation. It's not just nurses that make mistakes on this, between patients, providers, pharmacists, nurses. This is one of the greatest challenges that I've seen in my practice is, let's say I'm at a long-term care facility. I see that patient go to a hospital. They come back, and now they're on 4 different medications. And doesn't look like from hospital records, there was a reason for that. So making sure the medication reconciliation makes sense, that is a very, very important role for nurses for sure. So gathering that complete history, home medications, and do not forget over-the-counters, herbal supplements, and random stuff that patients take, because the majority of them take things outside of what their medication list says, and some of those can be really, really important. So, I know it's a little bit extra work sometimes to write down, supplements and things of that nature, but there are, many over-the-counter medications and supplements that do cause harm, and they can be the cause of a hospitalization or an ongoing issue with a patient. And if we're able to see that, as a provider, as a pharmacist, maybe we can help pick up on any issues there as well. Identifying duplications, omissions, drug interactions on that MedRec process. Also make sure to, update those records. And, when you see an issue, when you see a discrepancy, when you see, 2 cholesterol medications on board and it doesn't seem right to you, ask, okay? So making sure that we're clarifying this with the primary care provider on discharge or admission or wherever we're doing medication reconciliation is so, so important. Documentation, we kind of went through those 5 to 10 rights, but again, on that MedRec type of process, making sure to document all those medications given or held. When we're talking about EMAR, recording that response, document what you taught them and their understanding as well. I think that's an important thing to do from a liability purpose. For your institution, let's say you're, discharging somebody from the hospital, for example, document what was taught, what was given to them, and, if they're understanding what they're supposed to do. That can lead to good questions from the patient, where maybe you're tipped off saying, oh, geez, maybe they don't really have a good understanding of what's going on. Maybe we should get social services involved. Maybe they need home care. Maybe they need, a better caregiver in place to help them, manage their medication. So good education there. Good important thing to do as far as teaching and understanding and patient education as far as that documentation goes. Note any adverse effects or interventions. Record medication errors per protocol. So I'll talk more about medication errors, but one of my biggest pet peeves is underreporting and not reporting medication errors, because a lot of times others are making the same mistake and it's maybe just not being reported. So I'm a huge advocate for reporting all medication errors and near misses, just so we can identify trends. And ultimately, that's going to help all patients be safer. So a little bit more on error reporting, following those safety protocols, barcoding, double checking, reporting those errors. I just alluded to that. Engage in root cause analysis discussions. So, maybe it's a look-alike, sound-alike issue. Okay. So maybe, you've seen a nurse mix up a couple meds that look similar, and maybe we've seen that 2, 3, 4 times. It's like, okay, well, we need to put a different protocol in place to use this medication because it's, being erroneously used instead of this medication that looks alike or sounds alike. So important to take a look at the root cause analysis of why medication errors are occurring. And this obviously helps promote that culture of safety, kind of that openness. And then using clinical decision support tools correctly. So that can help us kind of streamline decision making, and less likely to kind of go off the beaten path and utilize the technology that we have to make sure that we're not erroneously choosing a medication in the computer system, for example, that shouldn't be chose because we know we have this disease state that the patient has. So again, that's probably more so on the technology side, but you just want to mention some of those clinical decision support tools. Struggling with nursing pharmacology? Would you like a resource you can put in your hands? You're not alone. If you want to understand medications instead of just memorizing them, check out the MedEd 101 Guide to Nursing Pharmacology on Amazon. Written by a board-certified clinical pharmacist, this book breaks down high-yield drug concepts, clinical pearls, and real-world examples that actually stick. Perfect for exams and the bedside. Whether you're in nursing school or already practicing, this guide helps you build confidence with medications fast. You can find a direct link to the 233-page book right now at meded101.com/nurse. That's meded101.com/nurse.